Hi friends, I have the honor and pleasure of having Dr. Deepak Mishra with me. He is rank 42 mid-year DNB exam. I'm sure we all come together to congratulate him and say that he's done a very well job. And he was a DAM student. He did a regular course in Indore and he followed it up with a TND course in DAMS Gautam Nagar. And I want to know his journey from him, and I want to initially ask him that how are you feeling?
I'm sir really feeling very great, and first and foremost I would like to thank you, and because I'm really great fan of yours.
So kind of you.
Thank you so much, sir. And I really admire you, and when I used to study, and I always watched the videos of the most of the PG toppers, and I used to think that one day I'll also sit there and also address the people, and today I'm here. I'm feeling very lucky and very proud, and also being the part of this such a beautiful family, DAMS family, which really give an atmosphere like your parents. They guide you like your parents, and every teachers really they are very helpful.
So like what I gained from I'm very grateful for your kind words, and what I've learned from you is that like you imagined yourself is sitting in this interview.
Yes.
A few years back, maybe when you saw others interview and you got inspired.
Yes.
And today you are here inspiring other people.
Yes.
Wow.
It's my pleasure to hear.
Yeah. So I'm sure this is what probably many people say this is what secret of life is.
Yes.
That what you imagine, you'll be there, you reach there. If you don't imagine, you don't reach there. So awesome.
You should have your very strong dream. You should think about something big, then you can make it possible.
Great. So what is that you want to first thing that comes to your mind today when you saw your result? What is the first thing that came to your mind that okay, I'm a rank 42? What was your first reaction?
Yeah, initially I was very shocked to see this because I know it was very tough for me because last year I got 6,000 and I was not that much satisfied with my rank, and then I shifted to Delhi and decided to prepare further, and then I was basically aiming for the NEET exam, and my focus was that I have to secure single digit rank, but thankfully I got in DNB, so I'm very happy with that.
So how was when you had a rank 6,000 last year, and then you decided you were getting options at that rank. Yes. You had options, but you still decided to put in another year.
Yeah.
So how did you manage your time in this duration? Because I've seen many people when they repeat, it is more in the mind. How did you manage?
Basically at that situation I talked to my parents that I want to continue. I am not happy with my rank. And my parents really supported them, and really special thanks to them that they have really motivated me. Okay, you can go and do whatever you want. And then I've shifted to Delhi within 3 days of exam result, and I shifted on around January itself, and I've joined TND second batch. And day one I have met to Sar sir, and he told me that you should not take that. You should not take from that NEET, because I have told that I got 6,000 rank, should I take or should I continue further? Then he told me you should go for next TNB and you will definitely score good rank.
Yeah,
so I'm very happy.
Maybe he was prophetic.
Yes.
And this time you've gotten a top 50 rank. That's a very awesome achievement.
Yes,
considering the number of students who sit for such exams. It's a very big achievement.
Yes.
So I also want to know from you, what role did DAMS classes in Indore and DAMS TND, how was your experience with the entire
Of course program? It was very good, and I have attended them very well. And I was very focused during classes. I used to write each and everything what faculty used to say, because I have never read any authentic books like Harrison or Robbins. I have never gone through that, and I was very depressed when I passed out from MBBS. I was thinking how would I clear this exam, because I haven't read anything, and most of the people who scored rank, they said that you should read Harrison at least, but I haven't do that. But even I have decided I'll make my concept by attending the DAMS classes, because they are very precious, and they are very focused and selective what you have to read. Basically they tell you, and according to that I have started my preparation, and then I used to revise the notes, do MCQ from the CRS itself, and then it's very I have really enjoyed that what I have done for me. Yes.
So what I gained from you is that your method was that you primarily focused on classes.
Yeah.
And you primarily used classes as your source of theory material.
Yeah, yeah.
Like, you said that some people would be using textbooks. You used classes as the theory material.
I have prepared everything. I used to write everything on my notes, whatever I found in MCQs or anything which is not in the notes, and I used to write them and make them in a compiled way.
And then you used to do it again and again, and repeat again and again.
But repetition was very important because without revision you cannot recall anything in exam.
Okay.
So that was the main plan which I had for me.
So what you feel that this people who are listening to you today would feel that maybe attending the classes, understanding, make sure that you make notes, then you did a little bit of improving upon the notes here and there, and then you started the revision cycle.
Yes.
And that was your mantra for success.
Basically what I do is I used to read the notes on same day if it's possible.
Same day.
And then I used to read again in the morning so that I can recall it better. Then if I have class on next day, then I used to go for class, or otherwise I open the MCQs, whatever books are available in the only for practice. I used to take the guides. I have never read anything from the guides. I only focus on the MCQs, and I just try to find out what is missing in the notes and immediately write them. So that was the main thing. I have very compiled notes what I have actually, and then I used to revise the same thing after 7 days, so that I can.
You have actually done a very clinical thing. Like this is like textbook recommendation that anybody who reads on the same day is likely to remember it more. But then you forget after 1 week, and then you again reinforce it.
Basically,
which is very, very
I have followed each and every subject within 7 days.
Yes.
And I have never planned that today I'll finish anatomy or anything. If I am reading anatomy, along with that I used to read surgery. Suppose if I am reading thorax, then if any related topics like in surgery, thoracic trauma and all these things, I used to go through them also, because they are very interlinked. And
so you try to integrate things where you could do anatomy and surgery and try to correlate them.
Yes, same thing.
Which is actually very ideal to be done.
Same thing with the physiology. If I am reading suppose CVS, then I used to read from pharma, which drug are basically implicated on that, and then I used to read with this medicine also. Then I've integrated them, and sometimes I used to write them. Yes, I have read this thing from medicine, and when I used to revise them, I'll check it again, so that it is easier for me to integrate each and everything.
Very nice.
Yes.
So what role did when you came back to Delhi and you started the TND? So how did you approach TND? Did you come and give the test religiously?
Test
every
is very
time?
important. Test is very important.
Did you go back and check your mistakes?
Definitely. I used to check that. First I used to do that notes for 2 to 3 days. Then I go through the CRS questions if possible before the TND my class. And then again before 1 day of my TND class, I used to revise my notes. And on the day of exam, of course I will not score 100%. I used to try that I should score around 70 to 80%. That would be happy for me. Then on next day of my class, I again revise the notes of class and cross check where I was doing the mistake basically. So this was my plan in a week for TND.
Very nice. And then any teachers that you remember at this point in life, you feel that you want to mention?
No words. I am very speechless for you, and you have always motivated me a lot. I have whenever you online in FB, I always used to see your video and get motivated myself, and I used to read in library. Always I must think that one day I'll definitely meet to you. And
so kind. I'm sure honor is all mine to be seated with you today. I'm very happy to be here with you. It's a pleasure. And any other teachers that you feel that are
for medicine, Arvind sir is awesome. He's really god of medicine for me, and I have really built a medicine concept only because of him. And Tushar sir, no doubt, on the day 1 of TND, my first class was ortho, and day 1 he told me that don't bother about the NEET, just focus on coming exams.
You like orthopedics?
Yeah, of course.
It seems. Any other subjects that you?
Yeah, radiology is the second choice for me, but in the end, I'll prefer for radio.
Yes. See. And any, were you active on the DAMS Facebook group?
Yeah.
And what was your method of using the Facebook group? How did you ask your doubts, and what was your idea?
Basically, what I used to do is only during 1 hour before my sleep, I used to open the groups and see the questions of recent updates which is put it by faculty itself, and then I used to write them on my short notebook. Basically, I have some handbooks in which I used to write single liners and all these things. So I have made some short books like this, and then I used to revise in the last 10 days basically, because in most of the exams I have seen in JIPMER I got 400 rank, and in that exam I have seen there are so many recent questions were there.
Yeah.
And same thing about the aims also, and that was really helpful for me.
So what I actually liked about your approach was that you kept a lot of discipline in everything.
Yeah.
You said, okay, 1 hour, then strictly 1 hour, and
I
then
have fixed my schedule.
Yeah.
And around in a day I used to study around 12 hours.
Very nice.
Morning around 9:30 I used to go library, then I start my revision first, what I've read in last day, so that it should be better to grasp me in coming exams or something. Then
so I think it's a very important message that the students who are listening to us today will get, that discipline.
Yeah.
12 hours a day.
Yes.
Then first thing he did was, after the class he read the notes on the same day.
On the same.
Then he revised them on the day next. And then started a new topic.
Yes.
So very, very beautiful approach that he has kept, and that has actually taken him from a rank 6,000 in the last exam, and then now 42 this time.
Yes.
This has all worked out for him. Very, very nice. Very nice. So would you want to use this opportunity to thank somebody in your family members, friends?
Yeah, of course,
anybody who
my brother, sister and my parents, definitely they have really supported me a lot, and they have told me you should go for Delhi and prepare whatever you want, for which branch you are preparing, you have to do that. And especially thanks to DAMS family, you have helped me to
we are part of your family
to get such a beautiful rank, and especially for you, you are an excellent mentor. I have never seen like you.
So kind of you. And now it is your turn to be the mentor, and I want to ask you two short questions.
Yes.
Okay, these are the two final short questions for the day.
Yes.
One, I want you to tell people academically, like some topics that is your feeling or your gut feeling that they will be asked in the next NEET topics.
Yeah, in topic was, if I'll say that in major subject like first year, second year are very important. But what I used to do is topics. If I'll say that in
it's a very tough question.
Amino acids are very important in biochemistry. Amino acids in DNA processing are very important. DNA mechanisms, and like recent advances in that DNA fingerprinting and all these things are very important, because they used to ask in an integrated manner. And in case of medicine, I prefer that recent advances they ask in traumatic medicine mostly.
Okay.
Like in emergency management and all these things. Yes. And in micro, definitely that general micro is very important, because most of the questions comes from general micro itself. And in same thing for patho also, because general patho and that genetics is very important. A lot of the questions from genetics were there in JIPMER, around 10 to 15 questions were there from single chapter.
Yes.
And especially that minor subject, I would like to say that in minor subject you have to revise in 15 days. Around 2 to 3 subjects you have to revise within 15 days. But whatever your schedule it is, but at least 1 to 2 hours you have to give them at least in a 15 days.
So I think what we've gained from you is minor subjects, general microbiology, genetics, and emergency medicine. Very, very important topics that you've pointed. Amino acid metabolism also. Very, very important topic he has pointed out for the next NEET. And the final thing that I want him to do now is, now we motivated you. Now is your turn to motivate other people listening to you today, and say something that will inspire them, give them the fire to study for next 5 days, 6 days, push them.
My message is that you should be very persistent, and you have to make some schedule, because everyone knows that time is very limited, and you have to be very focused. You have to make some timetable for coming 3 months, and strictly follow them. Basically, that is very important, and keep revising every day. At least 2 to 3 hours you should give for revision, and that is very important, because in last moment it's very difficult to revise the entire subject. And before that, if you will cover around 50 to 60% revision, that will be very fruitful for you. That is going to give a excellent push for your exams.
So if I summarize the entire thing in nutshell, what he says is persistence.
Yeah, persistence is very
Persistence is his mantra for success.
Yeah.
Persistence has got him to a rank 42 mid-year DNB exam out of around 40-50,000 students who have set for the exam. Awesome achievement. On behalf of DAMS, I wish him all the best for his future, and I'm sure we'll hear from him in future as well. Yeah. I'm sure he's going to be a great doctor.
Possibly.
Congratulations.
Thank you so much.